Welcome to the GIE Author Interview Series. I'm Dr. John Saltzman, an Associate Editor of GIE and Director of Endoscopy at the Brigham and Women's Hospital in Boston. I'd like to introduce Dr. Chris Thompson, who also works at the Brigham and Women's Hospital as the Director of Therapeutic Endoscopy. Dr. Thompson is the senior author of a paper entitled Evaluation of Colonoscopy Technical Skill Levels by the Use of an Objective Kinematic-Based System. It's an interesting study that has the potential to change the way that we train our fellows and monitor our endoscopic competence. So Chris, why don't you tell me what inspires you to take on this project?
Certainly. Well, first I'd like to acknowledge some co-authors, in particular Dr. Keith Obstein and Kirby Vosberg, for their efforts in really what was a very multidisciplinary project. What inspired us to take this on was the fact that colonoscopy is a very common procedure. It's recommended that pretty much everyone by the time they're in their 50s has a colonoscopy. Yet there's still no validated or objective measure of assessing competence. So we thought that was one reason why we wanted to take this on. There are, of course, medical and surgical guidelines that recommend numbers of procedures that might be helpful to obtain competence, but those numbers range quite widely. And also there have been some recent studies that suggest those numbers might be potentially too low to really attain that 90% cecal intubation rate. So that was our inspiration, really, what set us on this path.
So what is kinematics, and what led you to apply this to studying colonoscopy training?
Well, kinematics is the study of motion, and it's actually a branch of classical mechanics that describes the movement of bodies or systems. And it's been shown to be very useful in training laparoscopic surgeons. And the major hurdle is to basically obtain and catalog the various kinematic movements in a precise way. And what other investigators have used to do that are electromagnetic sensors. And then these electromagnetic sensors relay information to a computer, and they can store all sorts of specific information about movement. And so we had experience with these electromagnetic sensors in our prior work on image-guided ultrasound. And what was different about this, though, is that colonoscopy, the movement is much more complex. So we needed to put multiple sensors along the length of the colonoscope. We also had to modify the software, and then we used a standard colonoscopy model to assess that.
So how did you design this study, and what did you find out?
Well, we basically wanted to see if the system was able to differentiate between different skill levels. So we took 13 gastroenterologists, including attendings, and then 3 years of fellows, and we ran them all through this standard colonoscopy model. And they only got to use the system once, and then they each performed an exam, and it was a timed exam, and data was recorded. We then statistically compared the different groups to see if certain motion variables were significant, and if we could potentially use that as a benchmark or to stratify their skill levels. What we ended up finding, which was quite encouraging, was that not just one or two of the variables, but almost all of the motion variables were stratified based on clinical experience. So the number of colonoscopies they performed were directly related to those motion variables in the kinematic profiles.
So can you summarize that for me? What did the fellows, how did they do in the training versus how did the attendings do? You could clearly see a difference between the two groups?
Absolutely. So the fellows took longer to get to the cecum in the model. They also had longer path lengths, more looping. All of the other motion characteristics we were recording were not as good as the attendings. Not only that, but there was clearly a difference between first and second year fellows and second and third year fellows as well, and then even amongst the attendings. So that suggests a very sensitive measure. Additionally, we did look into a validated task load assessment instrument and a technical difficulty visual analog scale, and both of those also corresponded with skill level.
So what did you say with validated task load assessment? What is that?
Yeah, correct. So it's basically a questionnaire that tries to assess how frustrated someone gets with doing a procedure, how much mental attention was paid and how difficult it was by looking at various questions. And it's a validated tool that's been used in surgery and other disciplines as well.
So where do you plan to go with this from here?
Well, we're now using this in the clinical setting. So we're trying to attain information about kinematic profiles in actual patients across various skill levels. So we have attendings and various fellows participating in the study. And we're going to see if this holds up in the clinical setting as well as in that standardized model. This is very difficult for a variety of reasons because now there's patient characteristics which complicate things. But our goal is to obtain information and then hopefully be able to deconstruct the colonoscopic exam and then be able to create a better model for training and potentially for assessment of skill level.
So you think this is something that may generalize so that others can either use this model or this measure, or they'll learn from this type of research how to modify their training in colonoscopy?
Well, I'm hoping that what we'll be able to do is come up with a training model or a simple simulator so that fellows can learn the proper gestures and movements that will allow them to perform a more efficient colonoscopy. And then we hope also to either within that model or within a second model or simulator have one that can actually assess skill level and assess competence. This might be very useful in training programs, but it could also be helpful in recertification or assessing to see if people are maintaining their skill level.
Well, thank you for discussing your paper with us today.
Thanks very much.